Good afternoon, everybody. Hope everybody's doing well. Hopefully you enjoyed the weekend. It was a very nice weekend. Getting some data, a couple updates, and then I'll take some questions. No new deaths over the last 24 hours, so very good news there. Again, we've lost 204 people directly related to COVID-19 since the pandemic started. We should remember that, how the virus impacts our vulnerable. When we look at tests over the weekend, we received over 4,440 tests from Onondaga County. In addition to this, which is not in our data points, we'll decide if we start incorporating it, but I think it is important to talk about it. At Syracuse University has performed over 13,000 pooled saliva tests on arriving students. So while we may incorporate some of these in our data, is if there is a positive, it counts towards our positive numbers. But right now, we are not using the 13,000 tests related to our positive percentage rate yet. We'll make that decision. But that gives you an idea of, in a week, that's almost essentially doubling our testing from that. Now, will they do 13,000 every week? Of course not. But it's more testing being done, different types of testing now that certainly helps us find pockets of infection. Again, the surveillance tests lead, if there is a positive, to a diagnostic test. And then from that diagnostic test, if there's a confirmed positive, that individual then goes into isolation like anyone else. You contact trace, and it leads to quarantines. So a lot of testing being done. Actually, very, very happy with overall program that was put in place at Syracuse University. Again, when we think about some of the threats to our positive infection rate in the community, we've talked about travel from outside the community coming in, or people going outside the community and coming home. We've absorbed those cases. We have more today. When we talked about bringing back the students into the community, important for the community. We're a college community. We've brought those students back. Round one, we've absorbed these cases and haven't seen any upticks yet. Certainly, we need to continue to be diligent, all of us in the community, with best practices. Hospitalizations, 17 in the hospital, 4 waiting to return to a senior facility. They no longer need hospital care. They just need to pass a negative COVID test. They need to have a negative COVID test to return to their home, leaving 13 folks in the hospital right now who need some sort of hospital care. Out of that, 4 individuals are in the ICU. Certainly, let's keep these people in our thoughts and in our prayers. Out of the hospital numbers, 14 Caucasian, 2 African American, 1 of another race. Overall, we've had 3,646 positive cases, up 9 since yesterday. I think yesterday we had 9 cases as well. 3 travel-related, Maryland, Pennsylvania, and Colorado. 2 from a congregate facility or group home. 4 from community transmission. We have 190 active cases. That's up 9 from yesterday. And so far, we've had 3,257 recoveries. So certainly, hopefully we'll have a good week of recoveries and a slow week of cases. Our infection rate, 7-day average, 0.7%. So overall, things are very, very good. When you look at and you start to micro-target what's going on in your community, how can you make things better? Some unforced errors. And certainly if we've had cases over the last week that an individual went symptomatic, they went out into a facility that led to people in that facility getting sick, and it led to numbers that in a perfect world, if that individual stayed home and got a COVID test, we probably would have, we know we would have less cases. Which would have made that rate smaller. So it just shows you no ill intentions, just we need to remember when we're sick, we don't go out and we don't socialize. And right now, many of the symptoms are COVID related. It's really important that we get a COVID test. Let's rule that out. And then that way we'll continue to see our overall positive rate very low, our reinfection rate very low, and we'll continue to be able to reopen our economy, reopen our community, and live with this virus in real time. Looking at some of the cases over the period of time here, 2,093 have been female, 1,553 have been male, 308 under 19, 727 in their 20s, 488 in their 30s, 437 in their 40s, 537 in their 50s, 414 in their 60s, 305 in their 70s, 270 in their 80s, and 160 in their 90s. One of the big things we've been working on with our emergency management team and Dan Weirs, back to school testing. Again, we went through some of these dates in schools on Thursday. We'll do it again. Wednesday, August 26, 9 to 5, Lafayette High School for Lafayette and Onondaga Central School employees. Right now, if you can register appointment location on our county website. It's a very, very long website that I'm looking at right now. I'm not going to try to say it. It's on the county website. Certainly, you can pre-register for a time. And you will be required to show your school ID at the site so we know that you are a district employee. Thursday, August 27th, 9 to 5, Tully High School. This will be for Tully and Fabius Pompey. Friday, August 28th, 9 to 5, Jamesville DeWitt Middle School for Jamesville DeWitt, Christian Brothers Academy, and Manlius Pebble Hill employees. Other sites, Monday, August 31st, Baldwinsville Schools at the Baldwinsville Former Transportation Building. Tuesday, September 1st, Jordan Elbridge, Skinny Atlas, and Marcellus School Districts at Marcellus High School parking lot. Wednesday, September 2nd, ESM and LinkCorp at the ESM High School parking lot. Thursday, September 3rd, West Hill and Solvay at the West Hill High School parking lot. Also on Thursday will be the Syracuse Catholic Diocese Schools at the Bishop Ludden parking lot. And then Friday on 9/4, CNS at the CNS Junior High parking lot. If you did not hear the districts, they will be updated and we'll have those out right when they're scheduled. We're working on the rest of the districts right now. But certainly that's a lot of work with our partners, arranging this, getting ready. Certainly there will be investments made by the county government to make sure that the adults going back into the buildings don't have COVID. And then we are going to work on scheduling the high school students as we prepare for them to go back into the buildings. Again, we're trying to work with these different schedules and these different plans for what dates can be done there as well. Each high school has different plans on how many days they're going to be in the buildings. Why high schools? Because when we look at our school-age children, that's where the cases are. And the elementary age kids have not been impacted to date. Certainly during the course of the year, we're going to be doing the saliva test pool samples, and that will trigger diagnostic testing if we find a positive on the saliva testing. Heard today that certainly some of the what are considered low-risk scholastic sports will be able to start on September 21st. I don't think football can start yet. I think they can practice. In our control room call, we asked for some clarification on scholastic golf. If we can allow golfers, adult golfers, I'm assuming we're going to be able to allow scholastic golf. In addition to that, some of the winter sports that like to get a start, including basketball. I know I've had lots of questions on that. We asked that question as well. And certainly we continue to push and advocate for data-driven approaches to reopen our hospitality industries, utilizing the testing infrastructure if necessary. But certainly when you look at where we are with our positive rates, our reinfection rates, there's no doubt we should be having more than 50 people allowed at some of these events. So saying that, happy to take questions.
What do the logistics look like at each school site for testing?
Yeah, so it will be either our emergency management mobile site at a school or potentially the upstate I think mammogram van, which has kind of become the COVID van, and either of those, depending on who's partnering and where the samples will be going for lab testing. Partnered with Essentia Health, they will staff the site. There will be a doctor at each site, and then from there, the testing will go to the labs and quickly turn around for the employees to know if they have COVID-19 or not before they have to go into the buildings.
And how do you envision it looking? It'll be inside the buildings. Teachers will line up.
For the most part, we'll do outside the buildings. If the weather does not permit that, certainly we'll look to go inside the buildings. When you have a registration, you can control how many people are coming in. Again, we're not going to have a situation with more than 50 people congregating, waiting for a test. So if you got to the point where there was 50, we would then ask people to wait in their car until people came out.
But they register and then show up, and it's a similar
Correct.
process?
If you don't register, we still want you to show up. Just bring your school ID. There is a very long website link here that I'm not going to read, but on our Onondaga County website, Health Department, you can go click on that and register.
So as far as elementary school kids go, I know that you're not planning on testing them right now, but the saliva pool testing, is that you're going to see if there's any need to, or how?
I think they'll be part of the regimen. Of course, the parents will have to give permission for that, but certainly that's a way to screen. We're not suggesting that a elementary student won't get COVID or can't. We've had 26 elementary age kids essentially have COVID out of the 3,646. We can contact trace all 26 cases back to the original source, being mom or dad. And so that doesn't mean that won't change. So we think the proper way, using the data, is to use the pool sampling going into the buildings. We'll work with the scientists and the epidemiologists and the health department professionals on how often and how to get samples. But certainly the high schoolers are a little different. We know that, especially some of these older high school students, they're more social. They have found pockets of the virus. They've spread it to each other. So just like young people in their 20s, many of these folks don't get symptoms, and they're asymptomatic at times. So trying to catch that moving in, I think there's value in doing the back-to-school testing there. And again, the parents are going to have to consent. But so far in our experience, when we had various clusters over the summer involving some of these demographics, parents were very good at letting their high school kids get out and get a test to confirm that they do or do not have it.
Have you heard anything about, a lot of parents are asking us about outdoor classes. Have you talked to the health department superintendents about that at all? They're wondering if that might be safer in some aspect.
Yeah, I think overall, outdoor, anything outdoors is assumed to be safer. I think the question is, when you start from a position of strength, how much more can you really grow off the risk mitigation from outdoor classes? Certainly, I'm sure if weather permits, the leaders of the building will utilize whatever options they have. That's not anything we frown upon, for sure. But the district should be confident. They're starting their school year from a position of strength, stronger than most communities throughout the country.
Ryan, the tests for the school employees, are those going to be a one-time, or are you envisioning periodic screening, and are they voluntary?
It is voluntary. We envision periodic screening for the saliva sampling during the school year, one-time diagnostic test going back to school. And again, we will be working to cover any cost gaps there are, so this is not a free scenario here. This is very important to us as county government, knowing that the back-to-school operation is done really to the best degree with and covering every base that we can, and I think we've done that. I don't think there's another community in the state right now that's done as much as we've done to try to make sure we have a successful school year.
What's not free, the asymptomatic
Diagnostic
testing?
tests, yeah, asymptomatic tests diagnostically at times aren't free. We have a doctor there that can go through the various protocols to see if there's reason to have the COVID test, but sometimes insurance does push back on some asymptomatic testing.
Which this would be mostly asymptomatic.
No, not necessarily. I mean, the doctor will do a screening with each person, but the
But you don't expect a lot of teachers to have fevers and come and show
I
up.
don't think so. Whether they potentially had contact with different things, we'll see.
Okay, but so if the insurance companies push back, you say you are feeling some financial...
We've set up financial arrangements to cover this.
Do you have any anticipation what it'll cost the county?
Probably 6 figures. I'm not sure the exact number yet, but it's probably a 6-figure cost.
It's a lot of gap.
It's a lot. That's how serious we're taking this, and so we put everybody in a position of strength to go back to school. I have 3 children. The end of last year's school year wasn't good. Anyone who tells me that the kids did very well and it was easy for the teachers to do it all the way it worked, it wasn't. Now, there's time and preparation, and parents have options now, and districts have come up with different plans. But making sure that every objection or every concern going back to school that we can be part of can be met and addressed, that's what we're doing. And so the infection rate in this community, the positivity rate in this community are something everybody should be proud of. We work very hard, to get pieces of our lives back. Part of that is going back to school in whatever form the parents and then essentially the districts feel comfortable moving forward with. When we hear things about some of the concerns to public health, you're already in a position of strength. And essentially, how do we get stronger? We know the best practices. That's what they'll be doing in the buildings. But then I've always made the argument, and I'll make it until this is no longer an issue. But if you know every person in the room that doesn't have COVID, why do you care? They're in the room together. We know they don't have COVID. How do we know? We test. So if we can test the adults going back, going into it, at least to start the year. Again, every adult, we know they're more social. They get into different settings with different individuals. There's a little bit more risk to that, so people should continue to do the right thing. Wear your masks, sanitize, physically distance when you're in areas that you need to. And this has been a good recipe so far.
Just so teachers know what to expect, a doctor will decide before they go further if it's...
No, they're getting a test. There's no they will get screened by a doctor, just like anything. You'll get asked a couple questions.
And then the doctor decides if it's asymptomatic or a more on-purpose test.
Again, that's the doctor's call,
Right,
not my call or your call.
No,
It's the
no, I
doctor's
know.
call.
That's what a doctor will make that decision.
Correct.
And then if it's asymptomatic, are they asked to show their insurance card?
I would assume so. Yeah, I would
Okay.
assume that
And-
you have your insurance no matter what, just like any COVID test.
So insurance pays for whatever that company decides, and the county's willing to fill the gap?
Correct.
What kind of return times are you getting on tests now?
Good. Right now, we're seeing the national labs turning things around. They've changed a little bit. Some of the big ones, Quest, and some of those. So if you are a first responder, a nursing home employee, or symptomatic, you get really quick turn times, 24, 48, but 72 hours on average for the national labs. Our local labs are faster, so it's 24 to 48 for most folks right now. So we're getting back really, really quick data. It's good for contact tracing. One of the things that there was a period of time, as you recall, where the labs got backed up. Even with that slowdown in the labs, one would say, geez, we're going to have outbreak or this and that. Well, because you can't contact trace fast enough. Well, even with all of that, and that I'm sure there was cases we got because of that, the infection rate still didn't go up. So when you look at all of this, it shows the community how well they've done, that we've been able to take these one-time hits in this process, and we still didn't go the wrong way.
But right now, it should be 72 hours at the outside, it sounds like.
With what we're talking about for back-to-school testing, it will be about 24 to 36 hours.
They're get prioritized?
Correct. We've set up different specific testing for this, utilizing some of our rapid testing infrastructure as well.
Did the county buy a second Rheonics machine?
We did. Yeah.
And does Upstate have their Roche machine?
I believe their Roche machine, the date, I think it was supposed to be delivered was last Friday. I'm hoping it was delivered. I just said it publicly, so hopefully they'll confirm that it was. But we got, I believe our first Rheonics machine was delivered today, and our second one's next Monday. So with Roche, the Rheonics is our partnership with Cayuga Med, and all their Rheonicses. We now have quite a bit of rapid testing. We're encouraging the state to look at rapid testing as a way to open up segments of the economy that aren't open, and then looking at ways to, do you grab a Abbott's machine, which certain Abbott's machines are very, very fast, as a way to rapid test for venue events and or hospitality events. This is infrastructure that would be worth investing in for the community if we could use it to generate economic activity.
Will the Roche machine make Upstate more of a general testing site, or will that be mostly for internal hospital use? Because that can do, I think, 1,000 a day.
Yeah, I think it'll be both. I think they'll be able to take on more capacity throughout central New York and northern New York if necessary. Again, right now, looking as we start to prepare for wintertime, things get a little bit more busy in the wintertime just because you're going to have to rule out other respiratory ailments. Right so far, I read a report in the Southern Hemisphere right now, flu has not been as bad as they thought, and that might be a good sign for us, but that can change quickly in this. But again, in the winter times, that infrastructure is going to be busier, so having that rapid testing machine there certainly will help service us, but certainly is an opportunity for them to do more testing.
Mayor Walsh announced some pretty serious budget cuts on Friday that he plans to put into place. They're not a done deal yet. Based on the warnings he's given us, based on the warnings you've given this community, it's not a surprise to anyone that came. Where does the county stand? I know you're waiting for legislative approval to make some hour limits, but do you envision something similar, furloughs, some days out of work unpaid, to at least offset in the beginning until we know more from the federal government?
So the cuts the mayor put forward, the mayor is on a different budget cycle than we are. We're a January to January, and he's a June to June. So the cuts that he did, we essentially have already done, right? So we are holding, just think about this, we are holding 460 positions. That is over 15% of our workforce that were hired when I was county executive a year ago. There's bodies in these positions. Now there's not. We already cut well over $20 million worth of spending, similar to what the mayor outlined. We have, when you add those two items up, and you look at us using some of our reserves that we've been able to build up over our 10% limit that the legislature makes us have, there's still a hole. So the reality is there's nothing left to cut from a programmatic standpoint. We've cut nonprofits that rely on their funding. We've cut our programming. We've cut any sort of initiatives that we were very interested in, that we fought in our budget process to get funded. We've held 460 positions, which is essentially in a year, that's worth like $46 million. So people understand what that really equates to. So there's nothing left to cut but people. And so when you're looking at economic recovery, you don't want to put more people on the streets. So that's the frustration, is that we've done this. We did it very early. We knew we are more reliant on sales tax than any other government in central New York. And we made the tough decisions early. We have our teams doing more work than they've ever been. It's the most efficient workforce in the history of Onondaga County. And yet we're still looking at having to displace some of the workforce, whether it's temporary or forever, We don't know. We are going through the start of a 2021 budget process. So hypothetically, you could have a situation where we have to let go of people in 2020, but can bring them back on January 1st of 2021. So that's what we're looking at. We've been giving the federal government time to get their act together, and it doesn't look promising.
Mayor Walsh used the term crickets from
Yeah,
Washington.
I wouldn't say there's crickets, at least in conversations. Our delegation's been fine to work with, Congressman Katko, Senator Schumer, Senator Gillibrand. It's just not a priority. I think they're talking about a skinny bill. A skinny bill would include support for schools, which some of that money would come back into our community. But if they can't get something done in September, it's just not going to happen. The elections will play themselves out, and then whether or not there's still an appetite for further stimulus will be driven by economic reports.
What kind of departments could take layoffs without a profound impact on the services from Onondaga County?
None at this point. So remember, you have 460 spots right now that are already gone. So none of them can take a hit and not be impacted. And so we've held on to this as long as we can. And so certainly we're going to send over a resolution to the legislature. It won't be as many hours that we're going to ask for relief on that we had earlier in the year, but we're going to ask for that flexibility. And we're going to make decisions quickly. Then we're going to evaluate economic data. Then if we have to make more decisions, we're going to make more decisions then. And if we get sales tax numbers in that show we're not losing 10%, we're only losing 6%, that might change our trajectory a little bit, and then that's going to save us from having to make a couple decisions. So if we get federal help within that time, then that's great. That's what should have happened back in May.
When is that coming?
The legislature's going to hopefully consider it on their session in September, so around the corner.
How many gyms are open?
I don't know. I'm hoping probably all of them right now. So people have told me some of them have been open for a while, but certainly all of them are open. They're allowed to be open now. Our teams are going out and doing the inspections this week and next week, and we'll make sure they all get inspected so that they can stay open.
Ryan, Jim Walsh has come out and endorsed Joe Biden for president. Are you endorsing anyone? I
haven't really had time to think about that. What I'll say is I'm very interested to understand where all candidates stand, where the country is going in the next 4 years or 2 years, right? And I think that's, I'll take my time in evaluating that. I'm a voter just like everybody else, and nobody's entitled to my vote. You have to earn my vote just like everybody else.
Do you plan to endorse somebody before November?
I haven't really thought about it, Tim. Just watching the way everything works down there, I'm not emphatically interested in getting involved in D.C. politics when we're sitting here struggling to survive while there's a left and right food fight every other day.
I'm wondering what your direct line is to the people who are stopping the federal funding. You can go to Chuck Schumer and Katko all day long, but they agree with you. How do you get to somebody like Mitch McConnell?
Yeah, through our National Association of Counties. Again, most counties, there's lots of counties, right? There's more counties than cities. And so the problem is some of these states just haven't been hit fiscally, and they're more reliant on other streams of revenue. And so when you look at 50 states, 20 of them have been hit hard fiscally, but the states that rely on property taxes more than sales tax, they haven't been hit that hard yet. And eventually they will, right? Unemployment, people won't be able to pay their bills. You'll have a hard time collecting those taxes. But that's the challenge. So NACO has we've been very instrumental in crafting legislation for consideration in D.C., and it's just, there's just not the broad-based outcry for economic support, and that's what's slowed it down. If you're in a state that's not saying to your two senators, we need help for local governments, they're not going to take it seriously. And right now, that's what part of the challenge has been. Hopefully the White House put some money for locals and states back on the table a week and a half ago. Hopefully that's still the case, and the House can come and we can try to get something done.
You ready for this deep question? Why are the cities in this and counties up here in upstate so reliant? How are they structured to be based on sales tax so much to begin with? We saw that list that came out last week that has Syracuse third, but it has Rochester and Buffalo above it. So clearly there's a way these municipalities are structured more reliant on sales tax.
Yeah, it's a strategic decision to keep property taxes in check. 7, 8 years ago, everybody's screaming about high property taxes are. Not all states have school districts that can go right to the voters to tax. Usually, go find me a school district budget that's been voted down in the last 10 years. This is an area that voters usually support. So if you have regular 2% increases or 2.5% or 3%, whether it's right or wrong, they increase every year, they're going up every year. So when you look at your schools, your towns, your villages, your city, or your county, it's a lot of entities taxing one household. So then that household is disproportionately higher for property taxes. So we've made strategic decisions to cut the property tax rate in county government 8 straight years, all-time low. But to do that, you're more reliant on sales tax, economic activity. So you invest in things that drive activity, like an amphitheater, a state fair, Loop the Lake Trail, your on-center. Syracuse Nationals, your Visit Syracuse, your film, all these things you make investments in. COVID shut them down, plain and simple. They shut them down. So because of that, a model that worked very well for us did not work well for us for 60 to 90 days. And that's where we're asking for help. I don't need you to bail me out. We've already $100 million hole. We've already figured out a way to probably solve 70 million of it. But we still have a hole because everybody told us we should shut down.
You looked nervous when I said it was a deep question.
Well, you never know with these deep questions where these things can go.
Hey, Ryan, this saliva pool testing, it sounds like that might be part of the regular screening in schools. It sounds to me like something that insurance would not cover.
Yeah. Correct. And so there will be a cost to that. Our hope is, but it's cheaper than the diagnostic test. So we're working with Upstate on that. We're hopeful that, like we referenced, the skinny bill will get out of D.C. Schools will get funding. Some of these dollar figures going to schools are noteworthy numbers. And we've talked to superintendents about testing being part of that protocol. Teachers are going to want it. Parents are going to want it. And so that they can contribute into the screening. If you have a positive in the pool, that triggers a diagnostic test, which is covered by insurance, and or if there's reason to believe you may have been in contact with a positive, that's being covered right now widely by insurance as well.
And are the processing times about the same as they are for the diagnostic test?
Correct. Very quick, 24 to 48 hours.
Does the governor's order on waiving copays only apply to the symptomatic ones? Is that kind of the heart of what we're talking about?
Well, this is what we're starting to see is insurance companies are starting to push back on some of this, right? I got a report from in our cosmetic industry, our hairdressers and folks are supposed to get tested every 2 weeks. I got a report from somebody saying they're doing what they're supposed to do, but their insurance is now saying they're not going to cover them because they're asymptomatic, right? So these are the things we bring up to the state on control room calls. It's either got to be a policy change or the state's got to work with these insurance companies. They got more leverage than I do, to address this if this is something that we feel is necessary. Certainly nursing homes, I don't think anybody's going to push back on that from insurance companies because literally the testing is saving lives. We know that based off of where our mortality rates have gone, and we know who it was that had the greatest impact to this virus. So, but we've heard the insurance companies we know will start pushing back in areas, and that's why we're on the ground. We get the intel up to the state, and the state's got to make a decision. Do you want to have that mandate there? If you do, probably not fair for someone in the cosmetology industry to have to pay out of pocket every 2 weeks when other industries don't.
What have you talked about on the control room calls recently?
Really, the focus has been on getting these micro industries that are still limited, or events that are specific to our region, that are meaningful to our region, off the ground. And if we can't do it now, Trish, when are we going to do it? Really, I mean, and that's where it is. And we're pleased that we've seen gyms get the opportunity, bowling alleys. We're a diverse state, and then these things might not mean a lot in Long Island or New York City. They do mean a lot here, and so there's things that Super Dirt Week in Oswego County. This thing's hanging on a limb, big deal, and so might not be a big deal downstate. Big deal here for many reasons. So these are things that we're pushing and pushing for. Again, the hospitality industry is one where I don't know the answer to this, but I'm going to look into it. Maybe you guys should look into this. Out of our unemployment rate, what percentage of that is the hospitality industry, and what percentage of the hospitality industry is unemployed? If we can't open that up a little bit, that valve, with infection rates under 1, when can you? Can't do, if your philosophy is it can't open up under 1, it certainly can't open up under 2. So right now is the time for us to these businesses earn the right to try to open up capacity a little bit. We've positioned ourselves where the medical infrastructure in our community is not at risk. We can do what we need to do, and we have been doing what we need to do. So this has been the control room calls, some of the talk about getting these industries going. And again, a lot of questions coming from the community. We channel up overall, but overall, the community's in a great position. We've really, so far, we've weathered the storm of travel. We took a couple punches with no big deal with the national testing being backed up the way it was. We've welcomed back over 13,000 students at Syracuse University, a couple thousand more at Lemoyne, ESF, and look at the cases we have for it. It's, knock on wood, if we can get through this, that's why I think we can have a successful back-to-school campaign, because we've built up the infrastructure and done the hard work to be able to live with this virus at this point.
When you say hospitality, do you mean capacity at weddings?
That's the big driver, right? Banquets and weddings, and so do the math. I mean, if you're at 0.5, 0.6, what's that, 130, 140, 150 people technically that could be in a room that don't have it. It doesn't mean one person doesn't have it, or 2 or 10. But if you want to incorporate regulations or testing regulations, do it. Incorporate it. And then that's how these businesses can make a business decision to be able to reopen and try to make a living here in the fourth quarter.
Have the private casinos come up on your conversations with the state?
Not in our region. We're in the Oneida Nation region, so we have had we've been getting our payments. We got 2 payments so far, first quarter and second quarter. Second quarter obviously was not a large payment, but they've been open for the whole third quarter. So we have not been impacted like some of these other regions have been.
I just didn't know if you got any emails about Del Lago from your western suburbs. I know we've gotten emails about Del Lago.
Yeah, I think, from an employment standpoint, that's an employer. And, but for the most part, I think if you're a casino individual who likes to go to the casino, you have one 30 minutes away. You don't have 2 30 minutes away, but you have one, so you can get it done. So, but again, I feel for the community that sits in. That's revenue that goes to their government. That those are jobs for their many members of their community. And I think it holds true still. The same argument holds true. If we're not going to be able to do it, then let's just say we're not going to be able to do it, and so that people can move forward.
Oneida County executives said they're making a big push to get people from these big cities that now can work from home. Are you guys doing anything like that?
Yeah, I think what we do we have a strategic targeted marketing campaign? No. But what we do, we have a story to tell, and the story certainly was one of economic rebirth in the downtown, strong schools, really strong, diversified economic clusters where there's something really for anybody. And if you look at some of the economic growth projects from 19, they're all happening in 2020. You look at 2 Amazon projects, you look at JMA Wireless, Bankers Health Group, you look at Tessie Plastics, Ultra Dairy. Look at the Salt City market that's almost complete. These are all things with tremendous amount of investment. Syracuse University, what they're doing. Right now, the trades are at 100% work capacity. And so when you look at the segments of the economy, there are certain ones that are being hurt now, but these aren't. So these are all things where working remotely, if you want a high quality of life and you want a lower cost quality of life, and you want to be able to, within 30 or 40 minutes, go to various lakes or natural resources on the weekend with your family, you can't do that in New York City. And you still have the ability to live in a downtown here and have that city and urban environment. So I think we have a lot to offer, and I think Business Insider said we're probably the third best community in the Northeast that will benefit from post-COVID relocation. And so that's a positive thing for us to look forward to. And part of why we can do these things, and part of why we have film here right now, why movies are happening here and they aren't happening anywhere else, is because of our infection rate. So because we've done so well, we can do these things and make us different and unique and special. That's the same argument I'm making for some of these other industries on the sidelines.
Do you have an update on that Amazon plant?
Drive by it.
It's huge. I
looks
drove by it
good.
last week.
I drive by it every few days. Very happy about it. I think it's only like a tenth of the way done, too. So a lot of jobs going on right there, building it. And certainly we're going to have workshops for the permanent jobs soon to really kick that off later in the fall so that we start trying to identify the workforce who are going to be calling that facility home for a while.
Will prime delivery be less than a day in Onondaga County?
Andrew, that's not a question for me. That's above my pay grade.
Hey, you mentioned the saliva pool testing at SU and other colleges, and that's not part of your statistics, but their diagnostic tests and their positive results, those are incorporated into the county's numbers, right?
Correct. Yeah, so same thing. If they're going to do a pool sample, if they find a positive in the pool, everybody gets a diagnostic test, and then we get that positive in our numbers. What we don't get in the numbers is the 13,000 negatives in saliva that we can assume pretty close to would be 13,000 negatives in diagnostics, and that's because of cost. And so that's when you look at it, there's a reason the university's infection rates 0.2, maybe even a little less now, because they're counting all the tests in the positives. We have not been using all the negatives. At some point, maybe we'll give you without SU, with SU, because they are doing so much testing every week.
But, and it's early yet, they haven't been back for very long, but we are not seeing a rise in cases really
Nope.
yet.
No, not yet. And again, being here, we can argue being here for those students, if they act appropriately, is probably the safest place for them to be because of where we are with this virus overall. So if we know they don't have the virus, and we know that because we've been testing them twice, these kids have been tested twice, it's a pretty safe thing for them. It's a pretty good way. It's a boost for us, our morale, also a boost for some of these businesses, too, that rely on the consumer spending.
Speaking of your pay grade and the economic issues, have you thought any more about taking a pay cut, and will that be included?
Yeah, I think we'll assess those with what we're going to do with the whole workforce. We're not going to ask people to take pay cuts just to take them at this point. If we have to have true disruptions in the workforce, certainly there will be participation at all levels. Anything else? Thanks, folks. See you on Thursday.